Hi everyone, it's Fiona here from Harley Street Emporium, and I am joined today by the wonderful Kelly Morrell from Scalp Confidential. So, in a nutshell, Kelly, let me explain what it is that you do and tell me if I'm wrong. You sort of triage people, basically assessing their hair loss and then saying this is the most suitable treatment plan for you, and you also do certain treatments yourself. Is that a relatively accurate description?
Yes. Yes, it is. It is.
Excellent. All right. So let us run through some of the, because I mean, obviously, you know, I'm a menopausal woman, and you can see the lockdown hair regrowth here. But as you know,
Lockdown hair.
I've had a lot of hair loss and have tried one of the treatments that we'll get to, and it's starting to grow back. But it is a distressing thing for both men and women, and surprisingly, a lot more women than we think of actually really experience this, don't they? I remember the statistics you came up with before that are really is quite high for women. So how do you go about assessing what is appropriate, and where would you start?
Oh, definitely an in-depth consultation. To get a really good in-depth history is important. And you can go back years over people's medical history, operations, bereavements, etc., etc. And also to get an idea of what they have and haven't tried already. Some people come in completely fresh, not having done anything before, and others have tried near enough everything that they can think of, and either has worked and then maybe has stopped having an effect, or just hasn't worked for them. And a lot of people don't realise what there is out there now. I think they seem to think it's sort of traditional treatments like minoxidil and something like Propecia, or a hair transplant, and nothing in between. But it's the treatments, especially for all sorts of hair restoration, has really evolved over the last sort of 10 years, really. A lot of developments, a lot of new information, new research has come out. So what I do to assess them, normally, apart from an in-depth history, blood is essential, having a really good in-depth blood test. So you mentioned menopausal women, definitely to get a good idea of the levels of estrogen in the body, and then also in bloods, vitamin D, vitamin B, iron, folate, blood count, etc., etc. is really important.
Okay, and you mentioned the medical history, and I guess that's very important because there are so many different causes of hair loss, which I guess we really don't have time to get into. But I guess the other thing you do is I remember you looked at my scalp once. You actually look at the scalp as well, don't you? What does that tell you?
So it can give you a good idea of how, if there's any inflammation, if there's any sort of scalp disease. A lot of people come into me, they have some kind of irritation, inflammation, and it might be that they're just using, I had a lady come in, she was using the dry shampoo that we've spoken about before, I know, and it's not good, especially if you're using, it's okay if you want to use it for an emergency every so often, but using it on a regular basis, no. I just said, look, stop using it and see if it gets better, and it did. It might be something as simple as that. But yeah, it can show up inflammation, can show up any disease or possible what looks maybe suspicious or not, then you can investigate further. I normally then refer, if there is any kind of anything that looks a bit strange, I would then recommend them on to one of the doctors that I work with, or a dermatologist, to go from there. It can also show how progressive hair loss is or not. Some are just sort of beginning, like the hair might look to the eye kind of quite limp and dry and not sitting well, not feeling, just a bit meh, and limp and sort of, or it can look like there's obvious hair loss and patches of thinning, and it can tell you quite a lot of stuff when you're looking at it.
So assuming that there's no disease or any other outstanding reason that wouldn't make somebody be suitable for any kinds of treatments that you do, what are the ones that should we start basically? Let's start with the non-invasive ones and work our way towards surgery. We have on this. Let's start with PRP. What does that involve, and what does it do, and why does it help?
So essentially, it's using your own blood to help. I think using one's own blood to help heal themselves, whether it be for hair loss, skin, joints, etc., is genius. So you have to be, first of all, I have some people coming to me saying, "Oh, I tried it, PRP, it didn't work for me," or it worked once and then not the second time, or I've heard it doesn't work, so I don't want to bother. Again, you have to be pretty healthy. So, you know, if you're a heavy smoker and you eat a lot of junk food, chances are it may not work as well as if you're very healthy.
Well,
yeah. We normally suggest having, again, that's why the blood test is important, having a blood test just to see what blood count, what levels you're at. Because if you're pretty healthy and you've got a good doctor and a good centrifuge, which is the machine that we use, then chances are it works very well. And I've seen some excellent results with it. So what someone should expect, if you
storing your own blood, spinning it down, taking the platelet-rich plasma, which has the growth factors and the stem cells in it, and injecting it back in through your scalp.
So it's a bit like what someone would expect is, you know, you go into the clinic, it's like having a blood test. They take a little vial of blood, spin it in the machine, 1 or 2 spins, depending which system you have. It's what they call a closed system, the one that we use, which means there's no contamination. Nothing can get in or contaminate anything. And then, yeah, you have it injected back into your scalp.
Yeah. And what kind of results do you expect from that? Is it what does it do?
So it helps to stimulate your sort of natural, the natural process that your hair would go through anyways. All your stem cells that sort of the cell division, they divide, and you've got different stages of hair growth. So it helps to kind of kickstart and to nourish your hair in the growing phase. So helping your hair to grow healthier, stronger and longer, essentially, by using your own growth factors.
Which it is, you're right, it is genius, it's actually very clever. The next one up from that would be using other people's stem cells and growth factors, I guess, which is where we come to the which is what I had here, which is one of the things that you recommend, isn't it? So what does that involve, the meso with these stem cell and growth factors in them?
Yeah, so there are loads, well, I say there's loads, there's quite a few on the market. I have my 2 favourites, obviously. So they are, one of them that we've, I think the one that you've had is the calcium, which is stem cells from essentially cord lining from red deer. But no baby deers were harmed in the harvesting. It's taken from the birthing waste. So once the cord is cut, it's then derived from that. And one single syringe full can, I think it's like 6 billion stem cells just from one syringe.
So it's not like you're actually having the baby deer's cord blood injected into your head. It's a synthesized version.
It's synthesized, yeah. So someone explained it to me that, and it's quite well, it's a bit like, you know, it's synthesized in a lab, but it's very far removed from its original source, and it's a bit like putting a tea bag into a cup with some water. You get the antioxidants and the flavour, but you don't actually eat or drink the tea, the leaves. It's a similar thing. You get the goodness, but without actually, you know, getting any direct DNA from the red deer.
Yeah, and I'm actually really impressed with this. I mean, I don't know, you can see it better on the photos, but that whole area there before was literally, there was
but I can people can't see where I'm pointing at, but I can see the little patch there on yours. It's definitely there.
I mean, it was completely smooth like a baby's bottom before. So it has made a difference. And is this is something that you have to come to a clinic for, or is it something you can do at home, or how does it work?
It is best to do it in a clinic, just because not punching, but kind of stabbing yourself in the head at home, like anything, you're going to get people that take care and people that don't. So yeah, it's at the moment it's an in-clinic treatment only,
Yeah.
where you've got professionals that are trained and wearing gloves, and at the moment gloves and masks, and it's all very sterile. So yeah, an in-clinic treatment only. It could be once a week, it could be once a month. It depends on the severity of hair loss and who it's for and what it's for.
And there's another brand as well, isn't there, called AQ Solutions, and that's a similar sort of thing.
A similar thing. Again, it's derived from a slightly different source, but it is synthesized in a lab, so again very far removed from its original source. And I've had excellent results with both. I about 2 months ago had a car accident and lost some hair, which was in there, but mine started to grow back.
It is.
That's 2 months worth, which is good. But I lost a big patch of hair with the injury. I knew I could grow it back. So that's fine.
So you were fine.
If I can't grow it back, there's no hope.
Very true. Very true.
And I actually used the AQ on myself. So
Yeah.
I wanted to try out. They've got some new derma stamps with LED lights, which will come to LED lights in a moment, which is good for healing and skin and hair, etc. And their new derma stamps have got, I can't show you my one as such, but they've got the little LED light in them now. So as you're stamping the head, it shows up like red LED, which is good for anti-inflammatory.
When you're stamping the head, like because I mean I was injected, which was, I've got to say, it's harsh. But so is it less nasty if you're stamping than it is if you're having it injected? And when I say nasty, I just mean nasty facetiously.
Yeah.
I don't mean
it's nothing. Yeah, it's not. I mean, it's not the most comfortable thing in the world. I personally, out of injecting, rollering, and stamping, found that the stamping is probably the most comfortable out of all of them, which is why I do that. Again, it depends. I know people that roller it. I don't like rollering the head because if the head gets caught in the roller and you've got hair thinning or hair loss or previous injury, rolling the hair and catching it and breaking it is just going to make the situation worse. So no. But doctors injecting it is perfectly good too. I think the distribution of the stamp I like as well, because you're just stamping it, got the tiny microchannel holes, and the serum is getting into quite a large area at once.
Yeah. Yes, that's true. Yeah, rather than, because to have the injections all over the head would be, I mean, you just cover your head in anaesthetic cream, really, can
you? Yeah. I mean, it's you could. I suppose it depends. I've seen a lot of doctors use injections with PRP, and they inject at different points all the way along. Again, it's a little bit eye-watering but it's over in minutes. It's not. None of these treatments take a long time. It's 10 minutes and it's all over. So
yeah. And now, so you mentioned the LED. Is that something that you would do on its own, or just in conjunction with other things, or?
You can do it on its own, but I use it I'm a massive fan of combining therapies where possible and where they don't conflict with each other. So doing something like an AQ treatment or a PRP treatment or a calcium treatment, and then putting someone under an LED lamp for 20 minutes, half an hour, I think can only help. They don't really, I say there isn't. So I've read up on some of the sort of publications of papers that are out. They don't really understand fully how it works. They seem to think it's anti-inflammatory and healing. It has an anti-inflammatory effect on skin and acne, etc. So it can only help. I mean, I have seen it really help. Again, going back to looking at the scalp with my little camera. If I take photos with my camera post-treatment, with or without the LED, but normally with as well, the inflammation has gone.
Oh, that's interesting.
On that level. Yeah.
Yeah. So actually, for some of those inflammatory diseases, I mean, this is a quantum leap in logic here, but that might actually be quite useful for some of those inflammatory type scalp diseases as well. Yeah, interesting. Supplements, that's the next one. There's a whole industry out there of what you should take. What do you think actually does work, and what would you advise for people who are suffering from thinning?
I've always said, if anything sounds a bit too good to be true, it probably is. And there's a lot of people, they say to me, oh, I tried, I'm not going to name them, this, that, and the other supplements and products. And they cost like £7, and they claim to give you a big head of hair in a week. That's not going to happen. But the supplements I do recommend are the two basic things for hair loss. Is that the new study that's come out, I think it was a 2-year research of vitamin D on hair loss, and it does show that a deficiency in vitamin D has an effect on the hair. So I recommend the Zenny vitamin D, only because it's got a high, I think,
Sunshine bottled.
Yeah, sunshine bottled. That's it. In fact, somewhere I have mine. There's mine.
Yeah.
It's good for you anyway. It's got lots of other health benefits, but definitely as far as hair goes, vitamin D. Again, that's why we say to do blood tests, etc., to check levels. And quite often, male or female, if there's a lot of thinning and shedding going on, there's often a severe vitamin D deficiency.
Interesting.
That comes out. Yeah. And it's quite easily corrected with a good high absorption product. And Viviscal Professional, which is, as far as I know, if anyone out there is listening and wants to tell me otherwise, as far as I know, it's the most researched supplement on the market. And I use the clinic strength one, which is, I think, twice as strong as the one that you can get on the high street.
Yeah, in the professional level.
Yeah, so there's like, I think it's 450 and 600 milligrams of the active ingredient of the retail one, and 950 of the professional one. It's got a few other things in there as well. And basically, Viviscal Professional helps to accelerate and to nourish and feed the hair from within. I've seen great results either as a standalone treatment for the right condition, more as a support. It can't magic back a load of hair that you've lost, but if you've got thinning hair that's really struggling, to start taking that in addition to having an in-clinic treatment as a combination really helps.
Yeah, I could imagine. And I understand the professional one is probably more expensive than the than the over-the-counter one. But is it something you could start with the professional level, and then afterwards, as maintenance, use the over-the-counter one?
Yeah. So a good 6 months on the professional, ideally with an in-clinic treatment, and then just 1 or 2 a day on the other ones. Because it's not like the retail one's bad and the professional one's good. It's just it has vitamin B2 in it, where the retail one doesn't, and it has a few other different things, like different amino acids in. But they're both of them are good. But if you've got hair that's really struggling, and especially when we mention ladies of a certain age, it's excellent to support hair growth through menopause.
Yeah. And speaking of lady, you've frozen on me there, but I'm assuming you can hear me. Yep.
If
it comes to that point where nothing can be done, then there is always micropigmentation. Yes. What does this actually involve, and what does it do?
So this is tattooing tiny little dots on the scalp, either within a patch of hair that's been lost to kind of camouflage the hair loss, or as an all-over treatment to make it look like you have a full head of hair that you've chosen to shave by choice, rather than shaving it because you don't have any other choice. Again, for men and women, old and young. It's just a really good way of camouflaging the patches of hair loss that you have. It lasts, they say, between 5 and 7 years. Sorry?
Remember once that you were telling me that you have to be very careful about who you pick to do this, because you can end up with like giant dots, or you can end up with the wrong colour, and then, you know, as you say, it's a tattoo. You could have something not quite right for a very long period of time. So what should people look out for if they're considering that that's their option?
Doing some research about the person they are thinking to choose, like anything, like with any surgery or any procedure, getting to actually speak to the person who's going to carry out your procedure, for one, do some research about them or the company, and also ask if they have permission to see some of their own results, not just the pictures in the catalogue or on the internet. And also, people that my alarm bells would ring if people that try to get you finished in one session, because it's not a one session and it's over. It's very easy to do, but it's very easy to get wrong, probably more easy to get wrong. So if you get someone who's trying to rush it or trying to do everything in one go, you do end up with the patches merging together. If always insist on a patch test. We don't treat anyone without a patch test first. Make sure there's no allergies, and also to make sure the shading is correct as well.
That makes sense. Now, speaking of rushing through things, surgery, and we've got a couple of minutes. So surgery, it comes out who is or isn't. How do you decide who is or isn't suitable for that, and what does it actually involve?
So again, with the consultation, I think it all comes down to a really good consultation, no matter to what you end up referring people for, to ensure that they've got a good donor area, and ensure it's at the right stage as well, because I see a lot of people come in, especially younger men, who have like a tiny little bit of receding starting, and they want a hair transplant. And this is all fine and well and good, but sometimes you can have something like PRP or calcium or AQ mesotherapy, or some Viviscal to help keep your hair in good condition, and kind of prevent and sort of hold off that surgery until you really need it. Because if you have some surgery now, you're going to need another one in 10 years, for example, or 5 years. So you need to make sure you've got the surgery at the right time, having good donor area. Sometimes if the donor area isn't right, then, you know, you've got to have good quality hair to take from the back to put at the front and the top. And also someone that's suitable for mentally coping with it, because it's not that you have your surgery today, tomorrow you're going to have a full head of hair. It takes anywhere from sort of 6 to 12 months, probably 8-9 months on average, for your hair to go through. And a lot of people I see, they're not prepared to have their hair fully shaved down and then look a bit scabby and a bit strange for a couple of months. A bit peculiar. I don't think they're always ready for it. So again, it goes down to a good consultation, making sure that they've got the right hair, they've chosen the surgeon well, and that they're prepared for a little bit of a wait before they get their final result.
Brilliant. All right, let us wrap it up there, because we need to go to an Instagram live. I'm losing my voice as well. So Kelly, and people can find you at Scalp Confidential, and I will see you again in a moment.
I'll see you in a minute. Thank you.